My name is Laura. I am a long-term care worker at Wood County Job and Family Services. I determine eligibility for nursing home recipients, assisted living, waiver, DD waiver. Um, Basically anything that's super complicated. There's, there's a base Medicaid that's like community Medicaid called Agi. That's what most people between 0 to 65 get. It's the normal one, they pay for everything. Everything's always good. There's an ABD Medicaid, which is premium assistance, you're under a certain income limit and resources. And we could possibly pay for premiums, premiums and co-pays. Higher income limits are just pay for premiums. And then there's our programs. Our programs are usually people who have never been in the system, never worked, never had to go through an application with Medicaid. And we have to determine that they are below the income standard and then below $2,000 in resources. I always tell people the most complicated part is getting below the $2,000 in resources. Anything else we can work around. There's different ways to get around different things. But even if you have 2001 cent, you don't get Medicaid. Usually the biggest things that stop people are life insurance policies and cash value of life insurance policies. That will stop everybody. So a lot of people will then look at that. And if they don't, the first thing we look at is to see if they need a burial insurance. And if they do, then that's a way to spend out resources. It's always a process. We are the slope. Talking about, the slow process, we are the slow process.
Hey, listen, there's a lot of slow people, don't worry.
Yeah.
It's not just you.
It's not just you.
There's so many factors between waiver. We just determine if you are income and resource eligible. But then we also have a referral that we have to do. An area agency or CareStar has to come in and do an assessment on you to make sure that you actually qualify for that. And that's a 60-day process right now, at least.
So once you determine financially that someone qualifies, then the referral goes to have the.
We do it immediately
Oh,
when we
okay.
get the application. And some people actually go to area agency first and start the application process. And then they send stuff over to us.
Okay.
Is that determining that they like medically need assistance,
Yeah.
like they need help with it?
Yeah, those ADLs.
Okay.
Yeah, exactly.
Okay.
There was a split between CareStar and area agency at the beginning of the year. They're hiring workers. It takes a while. Sometimes people are told, we'll call you. You don't even have 60 days. We'll just call you.
Okay. Does that, I don't want to break your brain.
No.
Does that CareStar thing, does that not come into effect, or does that get negated if somebody's like, let's say they're in skilled nursing and they can't go home and they're paying privately to stay? Can those documentations from like the skilled nursing supersede CareStar? So that doesn't have to happen if somebody's in a community already.
Yeah.
Okay.
If they're in the nursing facility, no assessments.
Okay, this is just somebody who lives
obviously need.
in the world and it needs
Yeah.
to, okay.
There's different types of waivers. There's assisted living waiver where you're going to be going into the facility or you are in the facility. There is a passport waiver. There is
Ohio home care.
Ohio home care waivers. Those are all assessments based also. Where we get it, we make a referral, we determine if you are income and resource eligible at the same time. The referral process is going on. And then area agency lets us know if they are income eligible, we send out a notice of action. Our assisted living waiver, it's interesting because you have to be in the facility. We can't approve without you being in a facility to begin with. Usually. You have to be in need of care or be in care for at least 30 days before we can approve. And then this would confuse me is there's patient liability. And then there's from the board. We say, you have this for patient liability. And we say, you have this for personal needs allowance. But by the way, for out of this, you're paying for your room and board. So it looks like they have like $994 that they're getting for a personal needs allowance. No, you're getting $50. That's all you're getting. And 994 goes for your room and board for assisted living. And then the rest goes to your patient liability, which is like premium basically. Our programs are nursing facility programs. You're going into the nursing facility, everything goes. Everything goes to the facility or,
Oh, they don't even get $50?
well, they get
Oh, okay.
75.
Oh, 75. Okay.
Just for nursing home, it is 75.
Okay.
And then premiums, if you have premiums that you pay, we can give you that deduction, but everything else goes to the facility. I'm chaotic, so.
Unless they're married.
Unless they're married, and then that's a whole other monster.
So when someone's staying in the community and not moving into a facility, because they still have to have resources to live
Yeah,
on.
they have to have resources. We do in that. For married couples, there's something that we do that's like a community resource question or community resource assessment. Where we put everybody's resources into a spreadsheet and then we determine how much either needs to be moved out of their name by the end of the year. Or how much needs to be spent down before they can even be on Medicaid. And that. The resources are like. If you have so much in equity in your home, over so much equity. Bank accounts, like insurance, cash policies, stocks, bonds. Bank accounts.
Vehicles, more than one
More
vehicle.
than one vehicle. If your spouse is in a community, your house can be exempt with the exception of that equity caveat.
But only one house. If they had a house like here and a house in Florida, they
You
have
have
to,
to include that,
okay.
yeah.
The full equity counts for the second property.
Mhm.
And if they own land, that's the same thing. If they own land, that counts. So a lot of people might own land, say, I have a client in Texas that has land in Texas. They haven't sold it. I'm like, well, you're over resources until you sell that.
Yeah.
So,
Yeah, and there's certain provisions if they have been in someplace else and how they count as a Ohio resident. Because if their primary is still in another state. They're not an Ohio resident.
Yeah.
Yeah,
Mhm.
they have to put things up for sale. The nice thing is if the house is up for sale, while it's for sale at a reasonable price. It's exempt. So it's not, it doesn't count until you sold it. And then most people end up being over resources at that point. The big thing I always heard of growing up and getting older was transfer of assets, which is the 5-year look back. That is, if you have sold anything or given away anything in the last 5 years. We need to know about it and we need to assess if it was proper. Proper means. Did you just give away $84,000 to your family? That's not proper. Did you sell your house? And it's a short sale. For $25,000 and it's a $100,000, $200,000 house, not proper. For houses and for vehicles, we look at like normal. Like New Book and for the auditor site. Sometimes we have to go and get like community information for stuff that isn't on anything else. Like trailers, some people have homemade trailers, so we have to figure out how to. figure out the price for, because those count too.
Boats, ATVs, RVs, everything you wouldn't think of that people may have or may even have on their property, as we deal with a lot of older people living on farms or somewhere else. They may have multiple junked vehicles that should be junked. They haven't done it yet, so those do count, unfortunately.
And they're just sitting there, even if they're just sitting there and they don't have the title anymore, we need to know about it so we can get it assigned, we can assess it.
Can I go back to the married couple situation? So say, we've got a married couple, the spouse needs to be placed. The wife is staying at home. I would assume in order for the spouse that needs to be in a nursing facility, there are income and asset guidelines that he still has. So what if their income? I mean, so the assets, say we've spent the assets down to what that limit is, whatever that is. But the income is still too high, but not enough to be able to cover the cost of being in a facility. Is there still a way for that spouse to get on Medicaid, nursing home Medicaid, in order to, even though their income might be higher than what?
Your QIC.
So, yes,
Yeah.
that is the QIT thing covered. Think that's.
It's right back
Yeah. So QIT, this is how you get income eligible if you have more than $2,900 or how much, 982.
in every month.
Yes.
And that's just the person going into the facility
Yeah,
or
yeah.
on the waiver, not the spouse.
Right.
Because the spouse's income doesn't count for those services
Yeah.
for the monthly share cost.
What about like? They're married, they own a home, one needs to be in a supportive environment, one is gonna stay in the house, and there's like a 401k. Do they have to spend the 401k private pay before Medicaid?
Depends. It depends on how their
If
calculation.
they,
comes out.
if they take monthly payments from it
There's
and
that.
they're appropriate for the size of the 401k. So just say as an example, they had a $500,000 401k.
Mhm.
That is not attached to a job right now. So we have some younger people that may have, I had this happen, a client, a spouse living in the community, still working.
Mhm.
His 401k was exempt because of his
He was still contributing,
work,
okay,
yes, and he couldn't access it.
okay,
But just say an older couple, if you have that, say you're over the threshold of 73 now, they would have to be taking required minimum distributions or a monthly payment. Then we wouldn't count that as a resource.
okay.
Same thing with an IRA,
Okay,
they would do the same thing.
because that's,
But it has to be appropriate and there's a table and a calculation that we can use. Say they had $500,000 and they're only taking $100 a month. Obviously, there's a disparity there because their
Sure.
lifespan is going to be longer. The payment should be higher for that type
Yeah.
of thing. We would have to look at that, but there are always ways. But usually if someone comes to us too and didn't start taking from their IRAs, they would just start like a monthly payment. So it wouldn't count as a resource. It would count as income rather than that. And it only counts for whoever owns it. So
Yeah.
it's beneficial for them to start taking payments usually rather than us counting it as a resource. Or otherwise they would have to spend it down.
okay,
We count it as a resource until they initiate and start receiving the income though.
okay,
And a lot of them, a lot of those statements will have what the IRS considers the RNG, and we go by that, basically.
As long as they're taking the RMD.
Yes. and it
Because
has to
sadly,
be
some
monthly.
clients still don't realize they have to take an RMD.
Yeah.
They should know, but
It has to be monthly too.
Okay.
You can't just take a lump sum out of that. And that's considered irregular payment. So it has to be a monthly thing.
okay,
If you do that and it takes you over, then we talk about the QIT.
okay,
Enacting the QIT is a trust document that says that. That says that. That money is gonna go to the state after you pass away. It can only be used for medical expenses, so your patient liability. Or if you have any doctor's bills, you do that, and actually the patient liability, or the personal needs allowance can come out of that also. What,
No, go ahead, I'm sorry.
so the QIT, the way that works is, say you have $100 more than the 2982. You're gonna take that $100 and you're gonna put it into that QIT account that's attached to the trust. Cause you're gonna have to open a bank account. And then it's so crazy because you're then gonna pay that back out. It could be, it's gonna be monthly, it's gonna come back out. We have people who put it in, take it out, pay. We have people who put the entire thing in, pay out of that. It's dealer's choice at that point, but it has to be every single month. And we have to request and see if they were eligible every single month. So we have to have those bank statements for the 12 months when we do a renewal. And we have to look, if they're not paid or if they're not paying into it, they're not income eligible. Sometimes people made certain have to do that. I have somebody now who's getting more money and they reported it, so they're hustling around trying to get it. A lot of my clients think, or a lot of my off reps think that you're just putting money in there and the state's taking it at the end. No, you're still paying out every single month. It's the sneaky, not sneaky way to become eligible for Medicaid, you know?
The
We're still
state,
paying.
yeah, the
Yeah.
state implemented it as a tool to allow higher earners to be eligible for Medicaid, because otherwise they wouldn't be. You know, you probably at Brookdale deal with a lot more people being self-pay that were higher earners, but once they get to our level where they ran out of assets, they're going to need to go on to Medicaid and transfer to a different facility or whatever. But they would never meet the income threshold,
Right.
but, and this locks down what they can spend the money on out of the QIT too. It can only be medical expenses, the personal needs to pay, or a MIA to a spouse, medical premiums, medical payments, that's it. And then, so they can't just use it for just anything. So it's kind of segregating the money from regular use to where this is your excess income, allowing you to be eligible. But now you can only use this for your care essentially, because they're now eligible then for Medicaid.
So, going back to the community spouse, sometimes the spouse that goes in has a higher income. There's always one spouse who makes more than the other. And the spouse who's living in the community needs that extra income to be able to stay in there. At that point, we do a calculation called MIA, which is giving that community spouse a certain amount of money determined with what their resources are, what their shelter and utilities are, and then what their income is. And that comes out. I've had people who are really close, they have QIT, their spouse gets $2,000. Maybe they didn't have any money at all. They're getting $2,000 to stay in the community. So they still have to put that money into the QIT and pay it back out. Or even if the MIA is the same amount as what they would, the same amount as their total income, and they had a QIT, they would you still have to pay into that QIT every month. Just, you have to be income eligible.
Do you guys help people do the applications, Medicaid applications?
If they want, yeah.
I think that's where my background's in social work. I was a hospital social worker for many years and now obviously in this role, but I know when it comes to those applications are complex. I know, unless something's changed since the last time I told somebody about this, you know, when you're applying, you need to be certain that you check that box that says the person you're applying for needs either in-home or nursing home care, because if you don't check that, you're just applying for traditional Medicaid, right?
Yeah.
And I think a lot of people miss that.
If
So
they-
that is still the case?
Yeah,
Okay.
or they can I've had people put waiver at the top of
Okay.
the application or LTC, because when we get an application, we have a clerical unit that, does like a brief scan of it. They look for that indicator, they look for that, any indication, and they route wherever it's supposed to be. Um. If somebody is in a different county, going to a different county, there's a single person. They live in an apartment, they're not going home. It's gonna be actually a different county who's gonna be doing that, because they're not.
The county where they're going to?
Yeah.
Okay.
Yeah, we have a decent amount of applications that come in with their former address, not where they're actually living. So we throw a lot back and forth between us and Lucas.
We should feel blessed that we're in Wood County, though. You guys are, I don't mean to bash Lucas County, but you guys are 100 times better to work with than Lucas County. I mean, I don't know if they're just so overwhelmed. It's
They are
very, very.
I mean, it's a more metro and the bigger cities and towns that you get to, it is.
Yeah.
I mean, we're lucky we have 3 workers, which is not enough some days, but they don't have nearly enough people
Yeah.
to handle the load. And as you all know, working in the field, there's more and more need and there's not enough help for
Yeah,
all the way across the board.
right.
So, and I always say in our job, you don't know until you know.
Mhm.
So having resources and people that you can go to get more information is very helpful for sure.
And that's why, if you were applying for normal Medicaid, SNAP, that type of stuff. You would be in a regular bank and you'd have to call a call center to do everything. For these types of cases, you're calling us directly. And we're the ones who are answering your questions, we're the ones who are helping you out. I've probably seen more people face to face since the first of the year than I have in 12 years that I've worked
Oh,
at
wow.
JFS. But I was on the SNAP bank before.
Mhm.
Yes.
Some people, I had one man who said, I just want to know what you look like,
Oh,
because you're helping my mom out.
And he showed up at your front door, and that was weird. Yeah. Carl,
We
please.
don't, we do not have
That
to
was
complete an actual interview.
Like,
His name was Carl?
no, but
Oh,
that happened at Kroger when I was there.
really?
Yeah.
That's weird.
And
Somebody from Kroger followed you?
yeah, out to my car when I worked as a pharmacy tech, he followed me up to my car.
That's really scary.
And he's in his 80s, so
Oh.
like his wife was inside. He was not in
Yeah, I'm sorry.
there.
Huh? Shouldn't. Anyway.
We're excited.
But we don't have to complete interviews. We don't have to do face-to-faces. We can. Our one biggest thing is that clients come to the office thinking they can talk to us immediately.
Mm.
That is not the case because we do sometimes work remotely. So if someone has a question, we always have our number out there. If I send something to a client, they have our phone number. They can call us and we can make an appointment, and we could do a face-to-face or we can do a phone call. Appointments are helpful for us because we can't always just staff everything. If one of us is in the office, sometimes they get pulled aside to say, hey, you're here. Can you talk to this person? Well, what a quick 5-minute thing never is a 5-minute thing. So it could be 2 hours that you spent doing something that wasn't really even assigned to you. And you want to help. I mean, we want to help everybody we can help, but there's not enough time in the world. So, but we do face-to-face, we do phone interviews, we do phone calls, we make our own calls and callbacks here in Wood County. So it's helpful.
We work with a lot of business managers. There's a company called Medicaid Done Right, and they actually help people get on Medicaid. They represent the facility basically. So the Manors, all the Manors, Majestic, Woodhaven, they just got into Woodhaven. They're a processor who does all the contact. They submit the application, they're the op rep on the case. They are texting the client or the auth reps, like they're getting texts in the middle of the night from auth reps, and they are the people who do everything. And then we're constantly emailing back and forth.
Are they like a resource available to the community, or are they just through you guys?
They're not through us, they're from the facilities.
They're contracted, kind of like what you do.
Yeah.
But like if somebody needed to get on Medicaid, I could give them these people, no,
they're
they're
big-
facility
they're
drive that
facility,
shit.
yeah.
Got it,
They
okay,
have
They have
specific
contracts with the
contracts
facilities.
I'm sure what's the
facility.
okay,
And that's, yeah, like I said, that's like Manor or Majestic.
okay.
Our area Medicaid done right is a bigger one. And then you have your attorney, elder attorneys, obviously, that the people that can pay for that will go to them, but.
What did you say, Manor Majestic?
Manor Majestic, Woodhaven just got on,
Okay,
So when someone's in a community like Brookdale, I mean, obviously, we are private pay, we don't take the Medicaid waiver or anything in our building. So ideally, when someone moves in, we want it to be forever, but there are occasions where somebody moves in either because of a crisis situation, something's gotta happen quick, but we know that they don't have enough to stay there long term. Or someone outlives what they thought they were going to, so their funds run out. What kind of time frame from the time that they moved in and they're starting to kind of feel that pinch that we might be close to running out and need to apply for Medicaid? How far in advance would you suggest they do that?
like, I would say within 1,000, 2,000 for resources.
They need to be
Because-
pretty close to 2,000 because we
Yeah.
have people applying at 32,000 and they don't want to spend, which I say Christmas in July or whatever month it is. I'm like, I know you saved your whole life. You would never spend money like this, but you need to spend money. You need to buy things for yourself as a representative of a facility. You may not want to hear that, but like, if you need anything for your future that you're never gonna get the money back.
Right.
Spend it down. If you need clothes, you need shoes, you need a walker, you need, something that wouldn't be paid for by insurance,
Yeah.
buy it now, spend it down. If you want a tablet, if you want things, a big TV, a massage chair. I had a 90-year-old get a massage chair and a 60-inch TV in her room. And I confirmed that it got there because
They did go to somebody
it
else.
threw up a red flag to me that $6,000 went like that. And I'm like, she's 93 years old, but she was living her life. I said she was going to have some serious company in her room. But yes, so we have them apply too soon because we are in our constraints of time is 30 to 45 days. 30 days is Medicaid processing. Long-term care, if we're waiting on a level care medical need, we can go a little longer. If they're in a facility and the facility has already put in their level of care medical need documentation and the client hasn't given us what we need or spent down, they're denied at the 30th day. Even if we have to go to maybe stretch to 45 days or so, it's in that time frame, 30 to 45 days, and that's pretty much it. So if they're at 32,000 and they're not going to be paying, say, your facility $32,000, to get them spent down or whatever, it's too soon because we could start the process, but we're gonna continue to ask for the same things kind of repetitively. We can build on it. But I find people get so frustrated because I just gave you this. Well, I'm sorry, but now we have to go from that date that you gave it to now wherever we're at today. So that could have been another 45 days of
Right.
statements, new values on certain things to see where they're at, more receipts, more of everything. So sometimes if people are especially frustrated by the process, it's better to tell them when you're about to that threshold because then they're Medicaid pending. They obviously have to find a place to go
Right,
if they're with you.
so they could go into a place Medicaid pending.
if they'll
They
take it.
could if they accept it.
A lot of them
So
take it. A lot.
that's the key too, is
And not-
telling a
And
family.
what you're saying is, because like the admissions people, when we go on the tours, tell families about 6 months before you run out of money, start the process.
They said, yeah.
Yeah,
so they all
That's-
But I mean, is that unique to Lucas County?
No.
But that's what they're saying on tours. And
No.
about 6 months before,
Yeah.
we're gonna,
Information. Don't-
okay.
I have people where I'm like, it doesn't work this time, apply.
Yep.
I don't care if, I just need updated information. Like, you don't have to dig out that title again from 30 years ago. I just need updated information. I've had 3 applications 3-4 times, trying to get either information, trying to get people spent down. It's okay,
Yeah,
we'll do it, but 6 months, gather the information, don't
Okay.
apply.
okay,
Cause I've had people also say that to me.
Yeah.
"Well, the nursing home's telling me to do it now.
yeah. That's what there's,
When a person applies, we have our processes. You apply, we review your application. And then we start our process of sending checklists for verifications. That's a 10-day turnaround too, not including US mail times. So every 10 days, we're doing some action, sending a checklist. So now on one application we might deny, we've already sent 2 or 3 checklists potentially asking for verifications. If they didn't do everything and the application's denied, then we could be doing that. If they did it 6 months in advance, even if we tell them, sometimes we could tell, we're telling you so much all at one time, it's hard to wrap your brain around the whole process.
Yeah.
Like this.
We could be repeatedly doing that, like she's saying, 3 or 4 applications, because it does take, some people don't help, so it takes a lot longer, but facilities say that.
You know,
But the truth of it is that they have to be fairly close. They want people to prepare because they want them to be ready, but we can only get them so far. You couldn't,
yeah,
and it's good to get,
If you-
especially if they're married couple, we can do resource
I mean,
assessments.
if you have too much
prior
money, you have
to.
too much money. It's
Yes.
just, that's.
So it is, but they can always call our agency too. I always wish they would call, but and even while we're in the process and we've said one thing, we have other sources outside of us telling everybody has an opinion on what they should do, when they should do it. And so it is hard because we're saying, no, this is what needs to happen. And then they have, someone else over here and someone else over here. But yeah, it's close to $2,000, but it takes more than one application a lot of times, especially if they have a lot of assets. But the biggest thing is also the facilities, like leaving Brookdale and going to another facility. They gotta find a facility that will take Medicaid, take a person Medicaid pending, but if they're at, say, 32,000, they could pay a first month or 2.
Yeah. So it's maybe
As
better
a-
for them to move ahead of
Yeah.
time.
It is
If they
better
know.
because the facilities want you, I mean, they say 18 to 24 months of private pay. But if their census is low, they might take somebody who only has 4 months of private pay. But I've been in with clients before and like, but their loved one is at home and paying for 24-hour care. And they're just gonna burn through the assets there. And I'm like, but when that money is gone, you are beholden to whatever Medicaid facility has a room open.
Right.
You lose all your choice.
Oh, yes.
So if they need the help through end of life, it would behoove you to move them while they still have assets, because
Right.
now you have a choice.
And that's what, I talk to a lot of people that are in the rehab situation, like, or they've just applied, they're gonna get denied. But I'm like, if your loved one goes into a hospital situation and they're falling already, the end result is probably going to a facility. If they're going to rehab, so notoriously, we have some that'll go to rehab maybe in Lucas County, but they are gonna be in a facility in Wood County because that's where they would want to go. Like, if you can get in a rehab facility that offers Medicaid rooms, they're more apt to take you as well
Mhm.
on a transition from a rehab to a full-time care or even transition to assisted living.
Mhm.
It's easier to do that if you've got your foot in the door that way.
It is easier, it is.
And knowing progression with memory care is another issue too, is that if moves are traumatic, so if they will go to a facility, they might age with them or progress with them too.
But a lot of facilities don't have waiver in their memory care.
Right,
So then you're flipping to a long-term care
right.
in a secure unit.
It
Right.
just, and each
Guys,
they have their own.
Like, once they're already on that type of Medicaid, it's a
A
lot easier
million
to
times easier.
flip over because we already know they're income resource eligible. We're just waiting on that facility to send something to the state to update our case so that we can approve. I have been making a lot of phone calls lately of people who are trying to get in and calling the facility and saying, hey, Medicaid's pending. Or, hey, this person's gonna get approved. Can you please get them in so I can approve them?
Mhm.
Hospice, I was telling Stephanie earlier, hospice is notorious for saying, we need to get this person approved so they can move. Well, I can't. I don't have anything.
Yeah.
My system will not look at any of this type of Medicaid without them being in a facility sending us something for your agency updating the case. Otherwise, it's like, I don't know what you're talking about. It's like, there's no such thing as long-term care. I don't know what you're talking about.
Yeah.
It's just like, it just. It's fine.
It's so fun.
It's always an adventure.
So going back to the spend down, you want people to spend down before they apply?
Yeah, they can. There's certain things, I mean, I've had people, if they don't have a funeral, like, if they don't have an irrevocable burial contract. And they have like $10,000, some people like to have a big funeral. they can start that process. And that can be done within the month. But I've had people, I had, like, one of my first cases, they had $500,000 in resources, it was community spouse. Even with a calculation, that's way over resources, there's no way to even calculate that. I'd at least like them to be closer because we really can't, we're not supposed to keep them past 45 days. Waiver ends up making that different. But the state starts talking to my supervisor about, hey, how do we get this done? And they check up, make sure, they're very strict about.
For
those
government
timeframes.
processing, we have a very strict 30 to 45 day processing. If you know they're not eligible, and we can't make them eligible, so you have to deny, so then they have to reapply. It's repetitive, so if they're doing it too early. But if a married couple wants to apply, like she said, they can have a resource assessment done without an application as a married couple to see where they're at, to give them an idea of what they would have to spend down. But it's all dependent on the admission date of a person in a facility too, though, because if you had a married spouse and we're looking at their resources, whatever their date of admission is the date that starts that clock for us of whether or not they spent down enough. So say someone went in a facility in January, now they're applying. We would look at how much they've spent from January to now. So a lot of people still haven't spent enough money, even on self-pay, just say. So then we would be able to tell them, well, now you still need to spend 45,000. Your spouse might get to keep 150,000, but you have to spend 45,000 more before you would be eligible. And then once they get that guideline, then they can spend down a little more and then reapply. If that makes sense.
So if you're income and asset eligible, you're guaranteed
No.
to be able to, so like, how do you, cause I feel like as a social worker, like potentially telling somebody like, this is what you could do, but you need to spend down first, like, how would I confidently say, like, I mean, can you imagine like spending, I'm gonna go spend $20,000 to get to the spend down, like to be eligible, but then all of a sudden you spend that $20,000 and then you're not eligible, like.
And I just tell people to keep trying. We keep trying, there's 3 months retro. If that doesn't work, there's something called unpaid medical expenses. Where then we use that towards their patient liability. And that zeroes out their patient liability and they pay that back bill instead. That's why I'm like, there's always ways around everything except for the resources. Like, I've had people with $1,000 or $100,000 bills, back bills for the facility. And they're paying that instead of paying like the $3,000 that they're supposed to be paying a month.
Yeah, what that means is when we approve somebody and they have a share of costs, just say they have to pay $500 a month. If they have a $3,000 medical bill, we can apply it towards their monthly budget. So that instead of paying the facility the $500 for this month, they're paying $500 towards that $3,000 previous medical bill. As long as, and there's rules and regulations, so there's sometimes we have to lock that out, but it's a possibility. So if someone spent all their resources and they're waiting to get approved, as long as they apply and we're working on it, like she said, we can work on that. There's avenues to help a client, but it's tricky. Waivers are very tricky and it takes time, so it's not immediate. So if somebody spends down and they don't have resources, that's why we always say don't go below $2,000. Try to stay at or below $2,000. My key phrase, because you're not going to get it back, unfortunately. But say somebody had 10,000 and they've been holding that for 5 years, it's hard for them to spend it, obviously, but they do have to be spent down, unfortunately, so. Because it wouldn't matter. I mean, we would have to deny and continue the process, but
Yeah, I just end up sending new applications. Or if I'm in email contact with business manager or social worker, I send them the PDF of the 7,200, which is one of our applications. And then they can just resubmit. We start when we were before.
do you,
It always go, and Medicaid. there are circumstances where it doesn't go back to the first of the month. But facility Medicaid, barring them starting in the middle of the month, always goes back to the first of the month. It doesn't start, like, you can apply on the 31st of May. It starts May 1st. It doesn't start the 31st of May. So there's always ways around certain things.
There's a lot of moving parts and a lot of parts. We have JFS, we have Area Office on Aging, we have CareStar, other entities, other facilities with business office managers, so it's us working together. But at Wood County, we seek things out, especially Laura and I, like, if I don't know something or don't know who to contact, we'll try to find it for a client or figure it out. But are you dealing with most people in the community then, or?
Normally, I work here, so,
Oh,
generally, yeah, but generally referring out to like, just telling them their options and stuff, so.
Yeah, and waiver is a big one, but most people, like, if they have $10,000, they don't want to spend down to $2,000, but unfortunately, that's the caveat, they have to be spent down. But they could do that in repairs to their house, I have clients that they have to spend down, but they can make their life better by spending down. So yeah, don't go willy-nilly, I'm gonna just go blow a bunch of money, but they could make repairs to their home, update their car, make car repairs, they can do all kinds of things to help their life be better in the meantime, even though they're spending it down, you know. Those are better ways probably to spend it down than to just, you know.
Yeah,
if they do that though, they have to keep
Receipts.
the receipts or the bill and the bill. I like to have the bills and the receipts.
Yes.
Just because the state reviews the cases. So when the state comes in, they don't ask us. They're just looking, excuse me, to make sure that we had given them, or we didn't improperly give that to them, any type of Medicaid to them. Like, if there's $6,000 coming out of their account and we don't know where it's from, the state's gonna be like, what's this? Why are you not asking about this? I always tell people they want a story. It's a story. Just in case they get QC. I don't want people to get kicked off Medicaid. You know, I'm gonna do it right first.
yeah.
My head is
I feel like-
spinning. My head is spinning.
Say her head is spinning.
Yeah.
Agreed.
Yeah, I think that the most common thing that calls that we get is, hey, we're, in rehab or in a facility and my insurance is done paying, but I'm not ready to go home.
That's Medicare, yeah.
Yeah.
Because as soon as they're done with rehab,
Yep.
if they cannot they're at their plateau now, their new normal, then they would have to transition to Medicaid potentially. They didn't realize, because it's free. And then they realize they have their care team, their care appointment that says, Medicare's cutting you tomorrow, or they may have had 3 appeals already and got extended for 2 more weeks and 2 more weeks and 2 more weeks.
People get
And now they
lost in
have
that whole, I have 100
I have 100
days.
days.
Yeah.
Well, they said I had 100 days. Well, yeah, but you're at your max potential. You've plateaued.
Right, exactly.
You're walking 300 feet. You ran a 5K. You can't be here anymore,
Right. And that's like you said, they didn't expect that to happen, so now they have to scramble to do it, but unfortunately, they have to either go home or make some plan with the facilities, but sometimes they can spend down by paying the facility at that point. Some of them to stay there, they have to do private pay for 2 weeks, or at least pay something to allow them time to apply, but then they can reach out to us too. Anybody in Wood County that is on, we have people in Lucas that call us too, because they know we're a resource or word of mouth that call ours, and then I'll say, all right, is your family member going to Wood County? Well, I don't know yet, but maybe, because they know. But anybody can call us with long-term care questions too. They just can call the agency, and we have a screener of the week usually that will do those callbacks. So if they're in doubt. And most hospitals and places, even facilities, help people apply now too.
Yeah, Mercy Health is big on that. They always have an op rep that sometimes replies, and a lot of the business managers do.
Yeah, facilities ask us, like in that situation, someone's been in rehab and needs to go. Usually the facilities are reaching out to us too, to find out where they're at, if they have Medicaid, if they don't have Medicaid, how we can get them on Medicaid.
Like 2-3, yeah, emails a day at least or those.
How many people do you put on Medicaid like a month or like what? Like what's average to approval?
Honestly, I don't know.
I don't know, I say we
They're so
each
intensive.
carry 20 to 30 cases a month, probably. We're intense, I mean, where you're processing and working on them, I mean, it ebbs and flows, cause like. After a holiday, when families realize
Yeah.
clients
Yeah.
have declined or they're seeing things, and then in the fall, we have a lot of clients pass. So it goes in spurts, so then our cases go up, but.
At one point, like intakes, it was 17, but those 17 cases are maybe hours-long phone calls, tracking down documents for them, updating the case, talking to their lawyers, talking to Medicaid done right. It doesn't seem like that's that many, but with these cases, it is. It's like our other types of Medicaid. We can just, look at a certain resource and be like, okay, I'm going to approve you because you are income eligible. This one is like, oh dear, the family doesn't know what they have. Nobody's ever told them that they have or their parents never told them that they have life insurance policies. Their parents never told them about the stocks and bonds. And all of these families are coming in without any knowledge of what resources are with their parents. And I've run into this with my own father. Power of attorney. Have somebody who has power of attorney, and it must say that they have the right to apply for government benefits. That is what allows you to be an off rep and get everything in there. If your parent is not there, they can't sign an off rep form. So a POA is probably the most, and one of the most important documents to get started. My own father does not. He's like, I don't like the permissions on that. Oh, great, but something happens to you, what happens at the hospital and I'm there? Like, they're not gonna let me do anything.
Yeah, it only comes into effect if he's incapacitated. You can't just like,
What I say is,
not at all. Nope, I get it. Yeah, I don't know, so stuff.
Do the standard POA document, do you know if this like the standard one?
Not usually.
You have to like comment on the bottom and say that?
there's so many.
Yeah.
You can't even.
No, and the
There's
regular
so
standard
many.
one doesn't usually have it, and it can get added, but it's usually on the one that's like 6 pages long. But it could be added to one. I don't know that I've ever seen just the template online of a basic one, but most of them don't. And another big thing is the authority to appoint another authorized representative, somebody else to act on your behalf, because we have a lot of power of attorneys that think that they can then turn around and let Medicaid done right, just say as an example, which is the third party trying to help with an application. POA signs and says, oh, we will let Medicaid done right do this, and they have the authority to do it. Unless it says it in the POA documents, that person's not legally authorized to transfer authority to another person. So they have to say they can apply for government benefits, Medicaid, and it has to say they would be able to appoint another authorized representative.
Yeah, basically, if it doesn't say that you have the right to do it, you don't have the right to do it. Some people think it's implicit, it's not, you just don't. And then like 30 to 50 different types of power of attorneys online, because you just download the template. The medical power of attorney doesn't do that.
Well, while everybody's head is spinning right now,
Sorry.
we should probably start wrapping it up.
We can
That's a
talk
lot.
all day.
Yeah, that's oh,
It's so layered,
Yeah.
it's such, there's so
So
much
much.
information.
And I'm kind of chaotic. So
No, no, it's a great
I
conversation. It's just,
assume
yeah.
though, if any of these folks have additional questions, they could call your office and
Yep.
again, it's a lot and sometimes you don't even know what to ask, but if you can at least start a conversation and you can help them to figure out what questions to ask. And anybody have any last minute questions for any of our presenters?
I've just been wondering, how do you arrange to drop dead before you need? Right. I don't understand.
You're in the
Yeah.
wrong- you're in the wrong-
Yeah.
Right. If you ever have questions though, definitely, you can always call us.
Wherever.
We always have a screener, so we can just call the agency. Press 0. Ask for long-term care workers. Those people, we refer people to you guys all this time. Because I have
Back and forth.
someone on speed dial right now, one of my clients, I'm like, I handle your waiver, but the eligibility part of it, I don't. Care services, but then she has aunt issues, she has, other issues, and it's like, I'm sorry, but I can't help you with those, but can you please call area office on me?